Hey, good people. I'm glad you are joining me for today's lecture where we are going to be talking about cultural context and also being introduced to some interviewing skills. Excuse me as I clear my throat, I apologize. But I want to start out, first of all, by asking you what is the first thing that comes to mind when you hear the phrase cultural competency or cultural diversity? Not that you need to answer right now, but I just want you to think about it. You see, because sometimes when we just mention that phrase, cultural diversity or cultural competency, some folks want to put on the brake, hit the pause button, and say, well, I don't really need to know about that. And that's where we can kind of go in the wrong direction. As helping professionals, good people, it is important that we not only recognize and acknowledge that there are differences in our society. I'm not going to think and agree on the same thing that you think and agree on, just like we're not going to agree with our client, consumer, or patient. They may not agree with us. We have to not only recognize that, but we have to gain a respect for it. I'm not saying that we have to have complete solid acceptance and buy-in into everyone else's values and beliefs, but we must have a respect for them so that we would learn and that we would gain the respect for our client, consumer, or patient, that we would respect the journey that they are on and respect the shoes that they walk in, that we're not always going to fit it and they're not always going to fit our shoes. But if we work together, then we can reach that solid goal or that common goal, which is to empower our client, consumer, or patient. All right, so hey, let's get started with the lecture. When we talk about cultural competence and cultural diversity, we have to know, and you have to have this understanding that that does not just indicate a conversation about race and ethnicity. When we think about culture, if you've had a sociology course, then you know that culture embraces our values and our beliefs, what we define as our norm, as our foundation, and how we define who we are as an individual. So when we talk about cultural competence and cultural diversity, there's things that we just have to kind of open ourselves up to. Again, not that we are going to be a master of everything when it comes down to cultural competence and cultural diversity, but the important thing is that we're teachable. So in your textbook, there is information here that's labeled as core cultural concepts. I'm going to invite you and encourage you to read over that information, because that information, there are, I believe, 8 different pieces of information in there that talk to us about core cultural concepts, just the concepts. And in getting those concepts and getting an understanding of them, we're better able to apply them to some of the different areas that we may deal with personally and professionally. When we're working within a diverse population. One of the areas that we need to make sure that we address that our book talks about would be our attitudes. When we're talking about our attitudes, we have to recognize that there's 2 types of attitudes we can have when we're talking about cultural competence and cultural diversity. We have that ethnocentric perspective, and then also we have that ethno-relative perspective. Both of these perspectives are reviewed in your chapter, so please make sure that you read over that. But let me just read this first little bit for you when we talk about cultural awareness, when it talks about ethnocentric perspective. It says ethnocentric worldview is the individual's culture dominates their thinking to the point where we are expressing our values and beliefs on someone else. When we talk about that ethno-relative worldview, the book says that this is where we experience someone else's culture through their context. So meaning that we are stepping in someone's shoes, we are being invited to experience their values, their beliefs, their norms, and we're judging behavior based on what they know, what they value and believe, not that ethnocentric way based on what we believe. Excuse me. So I hope that makes sense to you. So when we're talking about being culturally aware, there's a lot of things that we have to take into consideration just for ourselves so that we are not standing with a critical mind, that we are not having prejudicial thoughts. But hear me, good people, hear what I say. When I'm saying prejudicial thoughts, I mean that we have to be able to identify that there is a group of those people that we may not necessarily be in full agreement with. We may not necessarily be in agreement with their values and beliefs. We have to be able to be confident in ourselves to acknowledge I'm not 100% in agreement, but I'm willing to learn. As long as we remain teachable, then when we talk about cultural competence, cultural diversity, then we'll be okay in working in the helping profession. As the book goes into and explores the topic of cultural awareness, it begins by introducing us and giving us 6 stages of cultural sensitivity. Now, the 6 stages that the book outlines, again, I'm just going to name them off, but I'm going to encourage you to read through these and get a good understanding of them. We have denial, defense, minimization, acceptance, adaptation, and integration. These 6 stages, this is where, again, we have to be teachable from the very beginning when we talk about denial to the very end when we talk about integration. Not saying that we have to, or that our expectation would be that everyone assimilate to our values and beliefs, or that we assimilate to someone else's values and beliefs. But we have to be able to recognize and acknowledge the denial and the defensiveness of it so that we get to the place of integration, so that we have this whole idea of working together and working with, as we stated in our previous lecture, working with the whole person, everything that it is about that person. Excuse me. That's one of the issues, or I should say one of the relevance when we talk about cultural competence that we want to be mindful of. Because when we're talking about working with the whole person, we have to think about every facet of this person's life, how it impacts the problem. So one of the things that the book leads us into when we talk about the whole person is this idea of looking at intersectionality. Now, when we talk about intersectionality, let me read this to you from the textbook. It says that intersectionality is a new understanding of the complexity of culture and the many facets of life that an individual has in places of privilege and power, or in places of discrimination and exploitation. That intersectionality, this is where all of these different variables come together and they begin to create this identity for our patient, client, consumer, whomever it may be. And then they function off of that identity, but also we interact with them based on that identity. So it's important that we have an understanding of intersectionality. Now, I need you to think about this from your own perspective. The different labels that may be applied to you personally. What is the area of intersectionality that you may experience or that you could identify that would have an impact on the way that you interact one with another? The way that you may see someone who is different than you, or also the way that you may see someone who is similar to you. So I want you to think about that. This whole concept and theory of intersectionality. There is definitely a really nice diagram in your textbooks that highlight the concept of intersectionality to give us a better understanding of how bits and pieces about our lives, our socioeconomic status, our gender, our age, our neighborhood where we live, our religion, all of these things come together and they form this platform or this foundation that feeds into the definition of who I am. So I hope that makes sense, good people. As we continue to talk about the whole idea or the concept of cultural awareness, we get to this place where we have, the book talks about cultural empathy. Not cultural sympathy, but cultural empathy. When we talk about cultural empathy, I'm just going to read this a little bit out of the book here. It says, cultural empathy, the ability to empathize with the feelings, thoughts, and behaviors of a member from a different cultural group. To empathize, meaning that I recognize and I respect the issues that you may be addressing, that I respect some of the hurdles that you may be experiencing. While I may not necessarily experience them, I have a respect for the struggle, for the battle, for the issues that you may have to face. And so sometimes the way that we can gain this respect and understanding is if we just take a moment and first of all, assess kind of where we stand with some things, and also just take the opportunity to talk with folks outside of our cultural norm, just to gain an understanding of what those issues may be, or what the values and beliefs they may have that may be different than ours. The book talks about, when we talk about cultural awareness, the book talks about this implicit bias, and having an opportunity to really assess our inner thoughts, maybe our unspoken thoughts or our unspoken ideas. And sometimes, or I should say, one way that researchers and theorists have gone about doing this is with the implicit assumption test. Now, some of you that may have had a counseling course, or a psychology course may have heard of or may be familiar with this implicit assumption test. For those who are not, and actually for everyone in this class, I've placed a link in this week's module, so that you have an opportunity to go through and complete some of the activities with the implicit test. This is a test that is hosted by Harvard University, and it's not so much for you to say yes or no, I agree or disagree with this, but it's just to assess, again, our immediate reaction, our immediate response to different situations, different variables as it pertains to marginalized populations. So with this implicit test, you will see different population groups based on age, gender, race, physical ability, mental health issues. So you'll have an opportunity to, again, pick and choose the group that you want to be tested on. This is not something that's going to be, again, to say, oh, yeah, no, they're wrong, or oh, yeah, they're right. But again, we're just looking at our immediate response, our immediate reaction when we are faced with making a decision about fill in the blank. So again, that is going to be a link that I make available to you all in this week's module. And again, just for you to test yourself, your thought process, not for you to feel like, oh, something's wrong with me. There's nothing wrong with you as long as you're teachable. Ooh, yes, I did throw that in there. All right, y'all. So when we're talking about cultural competence and cultural awareness, we want to make sure that we present ourselves, as I just stated, to be teachable, but also to know that there are some very specific skills that we have to be aware of when we're talking about working within a culturally diverse culturally diverse society and culturally diverse situations. When I'm talking about the skills, and I'm going to get into this a little bit more when we talk about our basic interviewing skills, we have to know that based on a specific population, there may be some things that we're not familiar with on what is acceptable and what is not acceptable. And that could be based on, again, a group defined by age, defined by race, defined by ethnicity, defined by physical ability, defined by mental health diagnosis. We just have to know and be able to recognize, but also be able to acknowledge what our limitations may be, what our skill level may be, and where it is for ourselves that we may need to grow. So again, with this chapter, when we talk about cultural competence and cultural context for interviewing practices, we have to, of course, like I said before, be willing to acknowledge what our limitations would be, where we have our strengths, where we have our weaknesses, but also when we talk about our weaknesses, are we going to be teachable throughout working with our clients, consumers, and patients? Now, hear what I say, good people. When we talk about being teachable, it does not necessarily mean that we have to go to a textbook, that we have to read a peer-reviewed article. Not saying that those are bad things, because y'all know I like a good article. But what I'm saying is, when we talk about being teachable, it is okay for you to acknowledge to your client, consumer, patient, I'm not very familiar with fill in the blank. Can you give me a little bit of information that I can begin to learn about fill in the blank? It's okay to acknowledge that. It is okay as the helping professional to be introduced to something by your client, consumer, or patient. Why is that? Because it shows your sense of humility. It shows that you know that there are areas of growth that you still need to work on, and you're willing to learn that by whatever means necessary, even if it means learning it from your client, consumer, or patient. Cultural competence in the helping profession. We have to remain teachable, good people. By remaining teachable, when we talk about cultural competence, this is where we kind of see all of this come together when we begin to explore our beginning or an introduction to interviewing skills. When we talk about interviewing skills, one of the things that we have to be mindful of with interviewing skills is well, actually, let me start from the beginning. The very first thing we need to be mindful of is our body posture. When we're thinking about our body position, and I really need you to consider this. If you've ever had a college course or any course where you are in person, I know this one is online, y'all, but just bear with me. But when you have these in-person courses, if you've ever had the opportunity to just scan the room and read body language, what message would your fellow students, would your peers, what message, if you are in a worship service, if you are in a faith-based service, and you're looking at the body language, what message is being conveyed to the speaker? Depending on what the body is saying or the position of the body, that speaker could be receiving several different messages. It could be a message of interest, could be a message of dismissive attitude, could be a message of anger or confusion. There's a lot of different messages that can be received. So as a helping professional, we got to be mindful of all of this stuff, of our body posture, our body position. We have to know that our nonverbal cues give a lot, as well as our verbal cues. One of the things when we talk about our nonverbal cues is touching. When we talk about touching, let me say this. Some folks like to touch. Some folks like to hug, while there are others that are saying, no, 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 don't bring that hug over here. We have to know as a helping professional where to be safe with our boundaries when we talk about touch. Yes, touch can be a good thing in the helping profession. Sometimes when you touch someone on the hand, just to let them know, I'm here with you, or to give them that feeling of you're safe. But there are some folks that are going to be kind of like shocked when you touch them, and they may snatch back. You have to present yourself, and you have to explain yourself along the way to your client, consumer, or patient. If you know that you're a toucher, if you know that that you like to give that affirmation of, I'm just going to touch your hand, explain that to the client, consumer, or patient so that they are not caught off guard, and offer to them to explain to you whether they would accept that or not. When we talk about touch, again, we're just letting the client, consumer, patient know that, yes, I am here with you. Also, one of the things we have to think about when we consider touch, excuse me, is what our environment may be like where we're working with this client, consumer, or patient. When I talk about the environment, if we are meeting in an office, how is the office furniture arranged? If we're in a cubicle, how is that cubicle furniture arranged? It may not always be to our advantage that we have a large space that we can have chairs facing each other. There may be a desk between you and your client, consumer, or patient, and that's okay. And your purpose is just to explain to them, that this desk it's here, but please don't see it as a hurdle, as a roadblock, as an obstacle to us having good conversation. Maybe you move the chair to the side of the desk, but some kind of way we have to make sure that we are taking inventory of our environment, of our office space, so that the client, consumer, or patient has a realization that I'm still approachable regardless of the placement of this furniture. Okay, as the helping professional, if you are working in a position where you are in a cubicle, let me say this to you, good people. Yes, you can still maintain confidentiality in a cubicle. It's all carried out through one of the things the book talks about, the tone of our voice and the volume of our speaking. I am a person who I naturally speak very loudly. I apologize if it's loud, guys, on this recording, but I speak loudly just because that's just who I am. But there are times when I recognize that I got to dial down the volume and speak in a tone that is more appropriate for the environment that I'm in. not losing the emphasis in what I'm saying, but just decreasing the volume. I hope that didn't go too low, y'all. I was kind of weirding myself out a little bit. Uh, but when we talk about our tone of voice, I want you to think about something. Think about when you are speaking with your friends or family members, and there's a point that you want to make, whether it is through sarcasm, whether it is through humor, whether you're angry or upset. Think about how your tone fluctuates. And now, as you think about how your tone fluctuates, think about having that same conversation or a similar conversation with a client, consumer, or patient. You know, when our tone fluctuates, we have to have an understanding about the power behind that fluctuation. So be mindful of that, good people, when we talk about our tone. As we're meeting with our clients, consumers, and patients, there may come a point in time when we just stop talking. Allow me to say this. It is okay to let the silence rest. It is okay in an interviewing situation to let silence be there. One of the reasons why you want to let silence be there is because it gives your client a chance to think about what was just said on their behalf as well as yours. Gives you a chance to process and think about what direction you want to go in, what questions you may need to ask of your client, consumer, or patient. Again, what was just discussed. Silence is not a bad thing. It can be uncomfortable, but it's not a bad thing. It's okay to just sit and think about what it is you need to say, what direction it is that you want to go in, how you want to discuss some things. In your textbook there, the book talks about 6 different types of silence. Review that, think about it, and practice it with a family member or a friend in a conversation, in a conversation of just letting the silence be and see what happens. Yeah, folks will start getting a little itchy. Folks will start saying something just to be saying something. But your goal is just to let the silence be, to think about the next direction that you want to go in with the conversation. Some of the things that we do when we think about the conversation, the flow of the conversation, is we have to consider, again, our facial expressions, some of the verbal cues that we give. Oh, wow. The facial expressions. Sometimes, good people, we got to learn to keep our face silent. Sometimes it's a challenge for me to keep my face silent, but that's something that we have to practice when we talk about working with our clients, consumers, or patients. Keeping our facial expressions to a minimum and based on the environment, and keep ourselves focused on what our client, consumer, or patient may be saying, helping us to stay focused on the conversation at hand without it being about us. You know, because sometimes someone may say to you, oh my gosh, I just saw this horrific accident on my way to work today, and I just don't know how to process things. And we may say, well, tell me a little bit more about what you saw. And as the client, consumer, or patient may start to talk to you about this accident, you may get the, dog. You may start to have all these responses, and then all of a sudden the conversation switches to you and your responses, your reaction. We got to learn how to kind of just have that poker face, if that makes sense, as much as possible. Trust me, I know the challenge is real. The struggle is real to maintain a poker face, but we got to be able to do that so that we maintain the focus on what the client, consumer, or patient is talking with us about. As we go throughout our interviewing process, and we are talking about questions that we may want to ask. Before we get to talking about the types of questions, we have to know that there is a part of the interview, I'm sorry, I had a little brain cramp, where we may want to reflect back to the client some of the things that they spoke to us about. That would be referred to as paraphrasing, where we are reflecting back to the client what I heard you say, and please correct me if I'm wrong, but what I heard you say is da 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 da. Oh, So am I clear in understanding that you thought da 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 da? So I'm reflecting back what the client said, not so much my opinion or my feelings, but just paraphrasing what they said. So the client has that understanding and has that concept that yes, you are listening to me. We may have lead-in conversations or lead-in phrases, again, to help the client or to guide the client in the conversation that they're trying to have or that they want to have with us. We have to be mindful, good people, all throughout the interviewing process. We are the navigators. The client is steering the vessel. And when I say we're the navigators, we navigate the conversation based on the types of questions and responses that we give. When I talk about the lead-in responses or lead-in statements, there is a chart in your book that gives you some different lead-in statements that you can use when practicing interviewing skills with your family members or friends. When I talk about questions, the book gets into and defines for us that there are two different types of questions. There are closed questions and open questions. Our closed questions. Closed questions are going to give you a very specific answer, going to give you very limited information. Closed questions are going to guide the client to this is all I want you to answer. What is your name? Your age? What is your date of birth? Are you married or are you single? What is your educational status? I'm guiding exactly the information that I want. That's your closed question. When we talk about your open questions, your open-ended questions are basically going to give your client the opportunity to have, for lack of a better word, lack of a better phrase, to have word vomit. They're going to allow open-ended questions, allow your client the opportunity to tell their story. And to tell their story, but guided based on the questions that you ask. So when we talk about our open and our closed questions, we have to know that we guide the conversation based on how we field these questions into our client, consumer, or patient. It's good, if we can learn to begin a conversation with just a lead-in phrase. Again, that the table or the chart that's in your book, read over that and become familiar with lead-in phrases. And then as we think about or we listen to what the client, consumer, or patient is saying, we know how to ask those closed questions, those open questions, to get the response or to lead the client in the direction that we want them to go in. Being mindful, good people, that the entire time we're talking with the client, our main focus is on what their issue may be and getting them to the place where they recognize or they begin to work on the goals that they have established for themselves. When we talk about our open questions, our closed questions, our lead-in information, we have a reflection of feelings. We have to know how to read folks' feelings, how to at least be able to define them or describe them. When you look in your books, there is an extensive list of feeling terminology. And I want to say this, in your book, it talks about that our feelings have two dimensions. And in the book, it says that our feelings have a dimension of category versus intensity. The category versus the intensity. When you look through the chart or the table that's here in your textbook with the feeling terms, I want you to think about, when we talk about the category, what feeling is the person having? And then the intensity, how am I defining that affect, that intensity, that place where they are, that feeling where they are? So this is something that takes a lot of practice and a lot of effort, where we identify, not just identifying the category, the feeling, but identifying the intensity and being able to relate that intensity with the appropriate terminology and the appropriate follow-up question. Okay, as we move on and continue talking about interviewing skills, some of the things that we need to be mindful of also would be summarization. How we summarize what the client, consumer, or patient has said to us. Now, using the skill summarization basically is in place when we want to, again, try to navigate the conversation, but also we use that not so much to interrupt the client, consumer, patient, but we use that to kind of, again, I want to make sure that we're on task with what we're talking about. I need to make sure that I'm understanding and that I'm gathering all the information that you're sharing with me, you, the client, consumer, or patient. Summarization is one of those basic skills that we use to, again, We're going to wrap up some of the conversation that we've had, and you could do this intermittently throughout your interviewing time. You don't have to wait to the very end. But we do this where we, again, wrap up some areas that we talked about, where we begin to, when we summarize their feelings, their objectives. And again, when we get to the end, where we summarize the entire meeting. And we use this to give us indication of the direction that we're going to be going in for our next meeting or for our assignments at the end of this meeting. And when I talk about assignments, I mean when the client, consumer, or patient is working towards their action steps and their goals. One of the other things that we talk about when we're looking at interviewing skills is confrontation. Now, hear what I'm saying, good people. When I say confrontation, I'm not saying that, oh, I'm getting ready to fight somebody, but confrontation in that you, the helping professional, are asking your client, consumer, or patient the appropriate question, challenging either information that they have said that is not consistent with what they've said in the past, or information that they've said that's not consistent with information that you received from a referring institution. You also could be challenging their behavior or their conduct as they're working towards achieving their goals. So when we're talking about confrontation, it's not so much that you want to say it with anger or frustration or disgust in your voice, but you're basically asking for clarification from your client. Wait a minute, Susie. So when you came in this morning, you said that da 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 da, but now you're saying da 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 da. I'm sorry, but I'm a little bit confused in why there's a switch up in your story. I just need clarification. That's what that is. I'm sorry. You know, Michelle, when you came in, you presented some information from your referring institution regarding the medication that you were on. But as we're talking, you're saying to me that you were never on these medications. Help me understand that discrepancy a little bit. Again, I just need clarification. So when we talk about confronting our client, it's just so that we keep our client, again, having that integrity for themselves, but also that we make sure that we have the correct information as we're working with our client, consumer, or patient on their treatment goals. Now, the last thing that our book talks about, excuse me, in chapter 6, when we're looking at our interviewing skills, is interpretation. When we're looking at interpretation, this is where you, the worker, have to be mindful of what you heard, and again, how you're making sense of it. And I'm hoping that makes sense. In your textbook, it says here, when we talk about interpretation, this skill can call on both the social worker and the client to be introspective. I got to think about what I'm thinking about. Worker, you need to think about what the client has said. Client, you need to think about what it is you've said. When we talk about interpretation, we're looking at trying to make this connection, as the book says, trying to make a causal connection between repeated behaviors, feelings, and thoughts. I just need to make sure, me, the worker, speaking with you, the client, I need to make sure that I'm understanding everything correctly. I need to make sure that this is making sense as we begin talking about a treatment goal or a treatment plan. So interpretation is just, again, another means of getting clarification. All right, good people. So when we talk about these first basic interviewing skills, we're looking at body position. We're looking at, and let me say this. When we talk about body position and our nonverbal cues, I forgot to mention eye contact, good people. Eye contact. Eye contact is very important. When we speak about eye contact, we want to make sure that we're making eye contact with our client, consumer, or patient, not so much that we're giving them the death stare, but that we're making that eye contact so they know that we are present, that we're here. Being mindful as we tie all this up with cultural context, there may be some cultures where giving that direct eye contact excuse me, could be seen as being disrespectful to someone in a position of authority. We got to be mindful of that, again, when we're working in this culturally diverse population. So body position, tone of voice, our verbal and our nonverbal skills, including eye contact, including head nods. Head nods. Let's not be a bobblehead, y'all, when someone is talking. and all they see us doing is bobbing our head, because that can send misinformation. Usually when someone is shaking their head up and down, it's usually an indication that they are in agreement to something. But some folks don't even realize that they're shaking their head up and down, or that they're going back and forth. We don't want to be a bobblehead, y'all, and confuse our clients with our nonverbal body language. So be mindful of this. Be mindful of the facial expressions. Ooh, y'all know sometimes I got to work on turning this off, but we got to keep this at our poker face. We talked about the type of question, closed questions, open questions. Our closed questions give us very specific information. It directs us specifically with what we want. Our open questions allow our client, consumer, or patient to tell their story. Reflection of feelings. Look in your book, good folks, and become familiar with and acquainted with all of that terminology when we talk about our feelings, when we talk about summarization, confrontation, when we talk about introspection and interpretation. Be familiar with all of this. All of this information is in your textbook and the chapters that are listed on your schedule for this week. As you read through the textbook and watch this video, be prepared to do some very interesting exercises for homework as well as on the discussion board. All right, if you have any questions, comments, or concerns, good people, y'all know how to get in contact with me, either by phone or by email. I bid you love, peace, and bacon grease. I'll catch you on the flip side.